A fracture is defined as a loss of integrity in a bone, which is usually the result of mechanical trauma. Bone healing intends to restore the continuity of the bone once a fracture has occurred. Bone healing occurs in 4 stages. In the first stage, which is known as the hematoma phase or the blood clot stage, this occurs from 0 to 48 hours post fracture. In this phase, ruptured blood vessels leak blood into the fracture site, which fills the gap between the 2 fracture ends. This clotted blood then provides a fibrin mesh framework between the gaps, which allows white blood cells to come into the area, such as neutrophils and macrophages, which clean up phagocytose and get rid of necrotic tissue. Fibroblasts come in and lay down collagen, and endothelial cells start to lay down new blood vessels. In the second stage, which is known as the soft callus stage, which occurs from 0 to 2 weeks, platelets and white blood cells come in and release certain growth factors such as PDGF and FGF, which causes the proliferation of bone cells and chondrocytes. By the end of the first week, the soft callus phase is well underway. This is also sometimes known as the procallus stage. Osteoblasts lay down woven tissue, which is also known as osteoid or an organic tissue, as well as chondrocytes lay down some cartilage. Moving into the bony callus stage, which occurs between the 2nd and 12 weeks post-fracture, the soft callus, which is all the osteoid tissue, starts to become mineralized. So calcium and minerals such as phosphate, this is sometimes known as hydroxyapatite, starts to mineralize and make the callus hardened. Moving into the remodeling phase, as we start to weight bear, so as we start to put force down into the bone, this causes remodeling. So osteoclast starts to take away tissue that is not physically stressed, so we start to lose some tissues, whereas the areas that are stressed will thicken, and this ultimately will reduce the size of the bony callus and hopefully restore the bone to its original integrity.